My name is Dr. Aziz Kamali. I'm Associate Clinical Professor at UC Davis School of Medicine. I like to discuss corona virus or COVID-19 with you. As you all know probably that virus is not a new entity. It has been with us since the creation of humanity. But we first diagnosed this in 1950, basically. We have more than 5,000 different types of coronas. The host is bat. Regular corona, human corona, does not always cause problems. Except maybe once in a while if it may cause a little problem. Regular virus, flu-like syndrome like aches and pains and congestion and cough for a few days. And coronas normally cannot reside or cannot at the normal body temperature, which is 37 degrees Celsius. It has to reside somewhere in upper part of the body, closer to mouth, and where the temperature is slightly lower than normal. It is between 35 to 36 degrees of centigrade, and that's why I mentioned that it is when it resides there from time to time, it may cause a little problem, flu-like syndromes. Basically, what we call the so-called COVID-19, it is one of those viruses that has completed its maturity or cycle in an intermediate animal. In this case, it was transmitted from bat to pangolin, and from pangolin to human, because after it completed its cycle, it made him actually adaptable to human temperature. I like to digress a little bit to say through the history of mankind there were only two more episodes of pandemic of coronaviruses. One was diagnosed in 2002, where the virus was transmitted from bat to civet cats, which is sold. These cats are sold in open market, wet markets in China, and it is slaughtered in fresh in restaurants in China. So basically, that was that is the one that caused the SARS-CoV-1, which is severe acute respiratory distress syndrome, coronavirus 1. That was it caused a little problem with same flu, like 8,000 people were afflicted, and from there 777 people died. The second time the coronavirus jumped from bat to humans to animal was in 2010 in Saudi Arabia, where the corona jumped from bat to camel, and it completed its cycle, and from there to humans. And basically basically then from camel to humans, and I think that was called MERS, Middle Eastern Respiratory Syndrome. 2,500 people were afflicted, and only morbidity was 800 people. What we call COVID-19, actually the incubation period is between 4 to 14 days, and the median is 5 days. And symptoms are like, basically like any other viral syndrome. It causes mild fever, cough, congestion, body aches and pains. But the main thing that is making this virus more distinct from other flu viruses are the pathophysiology. What happens is, as you all know, we have a system in our body called ROS system, renin-angiotensin aldosterone system in the body, and renin is made in the angiotensinogen is made, and renin-angiotensin system is everywhere in the body. Angiotensinogen is made in the liver. It is acted upon renin and it's converted to angiotensin 1. And angiotensin 1 is acted upon by angiotensin converting enzyme, which is available, which is produced in the lungs, and from there to angiotensin 2. And that is the one that causes spasm in the arterial system. It affects kidney function. It does that causes hypertension and cardiovascular disarray, basically. We also have another system in our body that is called CE2, ACE2, ACE2, and that is this was actually adopted from New England Journal of Medicine. I just briefly again I show this is a angiotensin 1 that it is made from angiotensinogen, and then angiotensin 1 is converted to angiotensin by a angiotensin converting enzyme. Then obviously angiotensin 2 causes this the so-called severe problem, cardiovascular problem, hypertension, stroke, and all the spasm in the arterial system. We also have a system in our body that concomitantly with the same ROS system, we have another substance that's made in the body that's called they call it ACE2, ACE2. It's made everywhere in the body, especially in lungs, kidney, liver. And when that is activated, actually normally it is also present because it does not want, it regulates the ROS system. So when ROS system become very active, these CE2, ACE2 are kind of is synthesized by the body to counteract the effect of angiotensin and angiotensin 2. Then sometimes this ACE2 is converted to what we call angiotensin 1 to 9, and the other one is angiotensin 1 to 7. They both cause degradation of angiotensin 1 and angiotensin 2. As I mentioned, that this virus that we have, it actually overactivate this ACE2, and that leads to what we call to cardiovascular relaxation, cardiovascular collapse. It affects everywhere, all the cardiovascular system in the body. As we all know, we have in our lung we have two types of alveoli type 1 and alveoli type 2. Alveoli type 1 and is responsible for oxygen for type 1 is responsible for oxygen and carbon dioxide exchange. Type 2 makes surfactant. Surfactant is the one that prevents the collapse of alveoli. So basically this virus is when it causes severe vasodilation, as we see it here, it also affects the alveoli type 2 in the lungs. It affects decreases the renin function. It increases cause dilation of the entire cardiovascular system, leading to it suppresses ADH, it suppresses angiotensinogen 1, angiotensinogen 2, and it causes a situation like what we call the septic shock, like septic shock like entity, or septic shock like situation in the body. The second mechanism that is causing the destruction or is fatal in the body is the activation of cytokine storm. And the way it starts, that cytokine, when viruses are trapped by glucophage, it releases the interleukin 1 and 2 and 12, and that interleukin 1 and 12 and 2 gets into goes to the immunity system. It tells this is the glucophage that makes us interleukin 1 and 2. That basically it goes to it activates the T cells, and when the T cell is activated, actually one T cell is activated one after another, and actually it activates the entire immunity system in the body, leading to cardiovascular collapse. And of course, the third mechanism is the interleukin synthesis. When actually there's interleukins are, we have two different type 1, type 2, type 6, 12. In this situation, basically interleukin 1 and 6 is activated, and that causes eventually all these three mechanisms, which is the vasodilation, cytokine storm, and the activation of interleukin, eventually leads to collapse of cardiovascular system. This is the main distinction between regular flu and the coronavirus. Yeah, well, I'd like to recapitulate and tell you the main thing that make a distinction between this virus and other viruses is that it causes vasodilation, which eventually causes the cardiovascular collapse. The second thing is cytokine storm, and eventually cytokine storm leads to also cardiovascular collapse and fibrosis, consolidation. And obviously the third mechanism is from glucophage that has already swallowed the macrophage. Macrophage that swallow the virus, interleukins are made, and interleukin by itself is also a defense mechanism. Eventually it leads to cardiovascular collapse and makes a situation like a septic shock in the body. And this is the main thing. One other thing which I like to mention, the predisposing factors, that age by itself a big it's a predisposing factor for this infection. Like in Italy, most of those people who died they were octogenarians, and also obviously some other underlying condition like COPD, asthma, and heart failure, and those also. And people of cancer, AIDS, HIV, heavy smokers, COPD, they are also considered the predisposing factors. Treatment, there's a lot written about treatment the past 2-3 weeks, and every day we see new articles. The most recent article that is kind of in a New England Journal of Medicine is kind of leaning, I should say, towards this one medicine, remdesivir, that was given to 53 people, 22 in the United States and 22 in Canada and Europe, and 9 in Japan. All 63% of them really did very well. The other thing I like to mention, which I didn't actually, the survival of this virus in the environment. if I have that condition, if I sneeze, that this virus could remain in the area where I sneeze for 3 hours on the so-called uh, regular surface, and could stay from 1 to 9 days, and cardboard for 2 to 4 hours. On steel and copper could last for 48 hours. And when the patient acquires this, the incubation is 1 to 14 days, as I mentioned, but 3 days before clinical manifestation, that person is considered contagious. And a median survival of virus shedding is 20 days. Uh, the list of medication, I think I mentioned that, alluded before, and that was the second medicine that is given, that is in China, is Favilavir, Favilavir, and actually there is a medicine called Actemra, that this medication is the one that prevents the so-called the cytokine storm, and also it suppresses interleukin. That is also uh, uh, somewhat promising, but I have to mention that there's antibody adenovirus vaccines are made. They are working on it at Oxford University, and also intranasal coronaviruses, and DNA vaccination. And vaccination itself, it takes it because it has to go through three phases: phase 1, phase 2, phase 3. And phase 3, obviously, it takes between 12 to 18 months, although they are trying to expedite the whole process. As we speak, we are probably more than 1.5 million people afflicted, and 90,000 probably died. 70,000 are survived from this condition. Of course, one other thing which is going to happen is they're getting sera or serum from people who recover from it, and that will be also in the future used for treating acute coronavirus. The autopsy reports are not available. One thing that is also happening is some kind of a coagulopathy in this patient. Phospholipid, as in 3-4 patients, they found that was high, which those chemicals cause coagulation and thrombosis in the body as well. I hope I shed some light. In summary, it's a very dangerous virus. Prevention is very important. Shaking hands, like hugging, kissing in some societies. We should also, if someone really, we need to keep our social distancing, like more than at least, although in some studies they say 5 meters, which is almost 15 feet, but more than 6 feet is good. If someone is sneezing and here we suspect that person, we have to stay away, and we always need to wear our the mask. We have to, one thing is very, very important, to clean our hands, and that is, and also if we, in some societies we may not have masks. Doesn't have to, we can make a cloth, and we sneeze, we could cover our sneeze in our sleeve if possible. So we are all in it in this thing. There is unfortunately a collapse of economies, east and west, and I hope we will. There is a in the New England Journal, there is a hope that in 10 weeks, which by mid-June, we will be able to kind of overcome this fear, the thing, but it remains to be determined, because June is not here yet. This is still month of April. We still have another 2 months to go. And I hope this video was useful, and if it is, please please contact me at akamali1@msn.com. My email will be written there. Thank you for attention. I appreciate it. Thanks.